There you go. Okay, so can you guys do that? Let's see. Can I steal one person from? No, you've got three. Let's just make a big group of you guys. Okay, come on over here because you're down a person. Okay, so who's going to have the hallucinations?
I'm reading.
You're asking questions? Okay, so voices come and gather in behind him. Okay, and then so you guys, yeah, come on. Actually, you know what? Can you join this group over here? Is that okay? We'll make it it'll be just a little bit more even. So, yeah, just stay there. There you go. Okay, you guys tuck in behind him. Lots of talking, okay, guys? Voices, lots of talking. Okay, go ahead.
What is your full name?
Sarah, I really.
How many siblings do you have?
There you go.
What's your Where were you born?
Designer shoes.
Come on now. Do you have any pets that would you like to discuss?
Those
Your
pets
pets are stupid.
How would you name your cats? Early after toast. How would they look like?
Do you like potato?
How much is it blonde?
I like cats.
My cat, she's black
No,
and white.
you don't.
And
You don't have this.
Calico.
This is a job. Spell your middle name. You cannot spell your middle name. L-A-C-E. If you were to eat one food, what would it be?
Not potatoes.
No, not potatoes.
Do you work? If yes, where and describe it.
You don't have jobs that want to hire you. Never want to hire you. Stupid. Do you have any hobbies? What's your favorite TV show? You don't have any friends, so why would that be your favorite show?
Okay, switch it up now and somebody else can play the different roles.
Yes, it's so hard.
I'm going to be a voice.
Alright, what is your name?
Taylor Page Haas.
Spell that. How many siblings do you have?
Sorry, what was that?
How many siblings do you have?
None.
Do you have any children?
No, I don't.
Where do you live?
Fort Capel.
Where were you born?
1995.
Do you have any
One,
pets?
I have Portia.
What kind of dog is Portia?
Portia's a lab.
How old is she?
Doll. She's 7.
Does she have a
Volleyball, baseball, the goose.
What is your middle name?
Goose, duckling, just gosling.
What's your favorite food?
Sushi.
Do you
Sushi.
work?
Yes, I do.
What job?
I'm a pro shopper at a golf course.
Which golf course?
Echo Ridge Golf Course.
Are you hearing voices?
Yes.
Okay, I'll get you guys to have your seats. That was awesome. You guys did rock that.
That's hard. Look at this is the hole I made when I fell.
Okay, so let's have a bit of a group discussion on what that was like. Like, what did you guys, like, what happened? Or what did you experience while you were doing
I was like
exercise?
trying so hard to listen to the person asking the questions, but then you get distracted by like some of what.
It takes like a second, like when you're answering the questions, it's like easy questions, like what's your middle name? And I'd be sitting there like, Alexander.
Yeah.
What is my name?
Yeah, for sure. So it kind of explains why you might see somebody walking down the street and then they start talking to themselves. Because it's really hard for someone not to pay attention to those voices. If, like Mark was saying, sometimes it's easier if you just acknowledge them. You know that they're a voice, and then you can move on with what you're doing, or you can distract yourself some other way. I'm going to give you a little bit of a clinical stuff, and then we're going to open up the floor and you guys can ask us some questions, okay? So what is schizophrenia? Schizophrenia is a chemical imbalance in the brain. They're basically neurotransmitters, which are the chemicals between our nerve cells, and that's how we send the messages back and forth, right? So that's what neurotransmitters are. And two of the ones that we know about with schizophrenia are dopamine and serotonin. Their levels are too high. So the medication helps to lower those. Just like somebody that has diabetes, you have to regulate their insulin levels. There are two main sets of symptoms, positive symptoms and negative symptoms. Positive referring to something being added to the individual's personality, something that wasn't there before. The two main categories are hallucinations and delusions. Hallucinations can involve all 5 of your senses, so you can be hearing things, seeing things, a sense of smell, or a sense of touch. or a sense of taste. So your food might not taste right. Some people say that their medication doesn't taste right, so it's poison, so they don't want to take it sometimes. That's when somebody is really quite sick. They might smell cinnamon or different things like that. The most common type of hallucination is an auditory or sounds. About 75% of all hallucinations are auditory. Now delusions, that's what we call fixed false beliefs that have very little basis in reality. And if you think back to my sister's story of the biker gangs, that would be a good example of a delusion. Her and her boyfriend had kind of wrapped their relationship around biker gangs, and it just became very big and all-encompassing. Now the other set of symptoms we don't hear as much about are negative symptoms, and that's when something's been taken away from the individual's personality. And those are things like lack of motivation, tiredness, social withdrawal, sometimes a blunting of emotions, so they won't feel the emotions that they know they should have, but they just don't feel them. So that's the negative symptoms. Now, getting into statistics, about 40 to 50% of individuals who experience schizophrenia will attempt suicide, and about 10 to 15% unfortunately die. So there's a high rate of suicide with this illness. Schizophrenia affects 1% of the population, so that's 1 in 100 people worldwide. It's in all races, cultures, and social classes. It also does not discriminate against intelligence. In fact, there's quite a few people that have a very high IQ that have this illness. But there's also individuals with a lower IQ that have this illness. It doesn't discriminate. The onset of the beginning of the symptoms is between the ages of 15 and 30. For men, it's usually in the earlier part of that, between the ages of 15 and 20. And for women, it's a little bit later, between the ages of 20 and 30, or 25 and 30. It's quite rare after the age of 30, and it becomes very rare after the age of 40. It does occur in children. That's about a 1 in 40,000 chance, but it does occur in children still. Now, if one of the things we like to say in all the presentations is the incidence of violence for people suffering from schizophrenia who are on their medication is actually less than the general population. They're less violent. You know, we do hear the occasional story of something, and that usually has drug use involved in it as well as their mental illness, and they've usually been untreated for quite a few years in those kind of situations. They've kind of fallen through the cracks of the mental health system. So for the majority, like if you translate that 1 into 100 people worldwide to Saskatchewan, that's over 10,000 individuals here in Saskatchewan that have schizophrenia, and they just go about their lives and, you know, live a normal life and manage their illness. The outlook is getting better. That's because the medications are getting better, and we're learning more about, we're moving into a new movement called the recovery movement. So we're learning more about how to manage symptoms, how to manage, you know, life, and how to set goals and things like that for individuals with schizophrenia. We do know that early intervention, though, is really important. Getting somebody when they're in those teen years or at the beginning stages of this illness can actually, they'll have a better outcome or a better prognosis. They'll have a better life usually. The cause is unknown. We really don't know what causes it. Like I said, it's in all races, cultures, and social classes. But what we do know is that it does seem to have a genetic component. It does tend to run through families. So if you have one parent with schizophrenia, there's a 12% chance. 2 parents, it goes up to 40%. But we also know that with identical twin studies, the exact same DNA, there's only a 50% chance. So what that tells us is there's more to the story that we don't know. There's other factors that come into play. But we do know that if you are predisposed, or it does tend to run through your families, one of the triggers for beginning the onset of the symptoms is the use of street drugs or alcohol. Cannabis or marijuana in particular increases your chance of developing a mental illness such as schizophrenia by 40%. There's something in cannabis that just tweaks our brain chemistry just that enough to kick in whatever mental illness we are predisposed to. The other trigger is stress. Going through a very stressful period of time can also be a trigger. It's not caused by poor parenting. You know, that used to be an old thing that was in one of the old diagnostic manuals, but it's not caused by poor parenting. It is also not a split or multiple personality disorder. That's a very different disorder. With a split or multiple personality disorder, usually there's some type of childhood trauma where the child's personality splits into another personality to cope with the trauma. So the new personality takes the trauma so that the other personality, the original one, can continue to cope. So then it'll continue to split into more and more personalities. It can have up to hundreds of personalities in there. With schizophrenia, there's only one personality, and then their symptoms, even though they're caused by their own brains, seem to be outside of them. They can seem some voice over here. Or that's why we did that exercise, so we can see it. And I put you guys all behind, so you can kind of see that it's outside. So that's the clinical. We'll let you guys ask us some questions. And a good chunk of this information is also in some of your handouts too. Excellent. So would you like to ask us some questions? Yeah.
You said that when you came to Canada, does that mean you're from another country?
Yeah, I'm from South America, yeah. But I lived in a high-risk neighborhood when we came to Canada. I lived in the north central of Regina. I don't know if you've heard of it. They call it the hood now. So, I mean, I was at risk. I mean, it was all over the place, you know, like my neighbor would have it, and that neighbor, and the guy down the block, and it was just available with no repercussions, you know. It's just $10 for a gram of hash, or, you know. So, I mean, like, for me, it was not a good thing because I think I was predisposed to it, and I was in a negative environment. So it made for a bad combination off the top, so.
Oh, wow, maybe it's because it's the morning. Yep.
So, 1 in 100,
Yeah.
what you're saying.
Yeah,
Yeah.
for schizophrenia.
So, is there any handle on the percent of people that go undiagnosed?
Well, there's definitely a lot of people that are undiagnosed, like even my sister is undiagnosed right now. So that is a possibility that that percentage is higher. But it is a worldwide percentage, and it has stayed flexible over several years. It's been 1%. Because usually at some point, they end up getting a diagnosis. Something usually happens, like you can go undiagnosed for several years, but at some point you have a major psychotic break and you usually end up with a diagnosis there.
Well, also, I think that untreated mental illness leads to dementia in later life. I have a friend whose mother, she was diagnosed and she took medication for about 3 years. She's in her 80s now and she has dementia, so that's another component to it. So dementia is basically, it's like psychosis all the time, and there's nothing you can do about it.
That would be like a correlation where they
Yeah.
kind of both run along the side, but we don't know if one causes the
Exactly,
other.
yeah.
That's what we call a correlation.
Did your sister's boyfriend have schizophrenia, or was
Yeah, he ended up going from the police station to the hospital, and he got admitted to the psychiatric ward and a diagnosis of paranoid schizophrenia.
Also, I mean, generally, this is not a broken toe or a sprained finger. This is a lifetime of treatment and continual struggle. With these medications, you can sleep for 12 hours every day and still not feel rested. So, I mean, I'm on a medication now that's working really well for me. This is the first time I was diagnosed in 1985. And the last 4 years is the longest period I have gone without a psychotic break or psychosis or out of touch with reality. And largely it's lifestyle, it's healthy lifestyle changes, no pot, no alcohol. I mean, you can have a beer a week, I guess. You know, just getting up in the morning, going to the gym, staying active, reading, playing chess, hanging out with friends, working part-time. I mean, that's where we're at now with this kind of treatment. You know, you're trying to empower the patient, so whatever dreams, goals, or desires he has or she has, it will facilitate a more productive life. Now, I don't know if that means anything to you, but if you wake up in the morning and have no reason to get out of bed, then what's the point of getting out of bed? So that's what a dream, goal, or desire is, right? So.
It helps to overcome some of those negative symptoms I was mentioning, the lack of motivation, because they sometimes linger even when someone's on a medication. They may still have some residual symptoms. More questions?
So So like the guy on Beautiful Minds, would that be one of the worst cases of schizophrenia? Like, one of the
Well,
worst?
on that, they're showing his period of time when he wasn't well, like his psychotic break. So they're showing, and that's in order to show the symptoms. So from what I read more about him is he actually is managing his medication, and he's doing quite well, and he still does some of his stuff through the university.
Well, also, he suffered in the 50s where medications were different. Now there's, like, back at that time, there would have been, I don't know, 5 medications to treat the one illness. Now there's maybe 100, 120. So the treatment, the way psychiatry has evolved from then to now, it's different, it's done differently.
Yeah.
So he has grown with the whole system.
Yeah.
So he's also reaping the benefits of today's way of looking at the illness.
And I know, like, currently he's very respected in his field and with his colleagues. They really have a lot of respect for him.
Well, I mean, like, you see, the thing is with John Nash, his work revolved around a topic called game theory, which is largely a part of mathematics called probability, which is generally one of the most challenging and hardest areas to work in. So
He's what led it so that we can play solitary on our phones and things like that. You know, he was part of that whole breaking movement.
Yeah.
A big part of it, actually. Oh, yeah.
That's
He-
the
Yeah,
So,
go for
like,
it.
we talked about hearing voices and like auditory hallucinations, things like that, but, like, how else can it manifest, or like, maybe
Well,
just
in
more
all
examples?
senses, visual, audio, olfactory, touch.
So, can you give some examples of what, like,
Like when I have symptoms?
if you have your own, sure, that'd be good.
Okay, well, like for me, you know, it's generally, like for me, it's not so much voices that are isolated, but more like communicating. Like I think I can communicate with someone telepathically or something, you know, that's just how it is. But, you know, at the same time, I can get a vibe from somebody and think, you know, well, this person may seem a little threatening, which a lot of other people can pick up on somebody else. But I think in my case, it's more like heightened, it's more noticeable in how I perceive things. Because generally I don't say much about anything to anyone about anything, you know, but I mean, like even doing these have kind of brought me out a little bit, you know. So I mean, it manifests itself. I mean, there are as many scenarios as there are sufferers, you know. Like we might hear the voice in the same audio way, but the nature of the voices would be different. Or they may be the same, or different and the same, you know. So it varies from person to person, you know, like it depends on their circumstance, their situation. Like me being a visible minority, I might think somebody is thinking or trying to call me a bad name or something, you know. So it's a context in which you're living and where you live and how you live. So.
Just to give it kind of more general with some of the people, like, because we have different speakers that come out. So an example of a visual one is you might be looking at a regular picture of scenery or something, and then you'll see a figure in there as well. It'll overlap what the reality is. Some people, one lady she was seeing, she kept thinking that she saw the RCMP going by her place all the time. And then stopping at the end of the block and staying there for like a couple hours and was watching her. And so she literally did see this car, but it wasn't existing. There, you know. For the smell things, like I had mentioned, like you might smell poisonous gases or cinnamon or flowers. And some people that are in recovery, that's what they use as their warning. If they start to smell something or one of their, you know, residual symptoms starts to come back, they know that they're not doing very well, and then they might have to have an increase in their medication or something like that. The hearing things, just to expand a little bit on that, some of the sounds, like even in that tape we played, there was more than just voices, right? You heard ticking of the clock, you heard the buzzing sound, birds, you can also hear animals like cats or dogs. Those things as well, the ringing of the phones. They'll hear the phone ring and they'll go over and pick it up and there's nobody there. You know, So that's a little bit more to expand on some of that.
I just wanted to address this young lady. You asked about the types of schizophrenia. Well, you're right, there are several types.
Yeah.
But the severity of each, there is no better or worse. It depends on how the person responds to the illness, right? So like for me, I'm paranoid schizophrenia, and there's somebody with refractive, for example, that's another category. There are different kinds of schizophrenia, but based on my interaction, how the medication works for me, my lifestyle, healthy lifestyle, of course, you know, and different types, but we have the same illness, but it's a different category. But it depends on how the person responds to treatment, how active they are in their own healing and health, and so, yeah.
And sometimes, you know, it's not a quick fix when somebody goes on medication. That first medication they try might not work for them. They might have to try 5 to find out the right combination. And then they have to find the right dosage, so they'll move the dosage up and down to find the right fit. So it takes a while to get on a good medication. that
Yeah,
works.
I mean, like I say, it's lifelong, right? You know.
I'll get you can still take questions, but I'll get you guys to fill out those white forms. That's the evaluation forms for me. That helps us with some of our planning.
So what do they actually do? You said you had psychotic breaks and you were hospitalized. Like, what do they do when you're hospitalized?
Well, they put you on a routine. Like you get up at 8 o'clock, you have breakfast, you have lunch, you have cigarette break, you have supper. You try to get in a routine. It's generally, the ward stay, the hospital stay is supposed to be therapeutic. It's a safe environment where, because most of the people with this illness, they're very mistrustful and they have shifty eyes, you know. But, so when you're in there, everybody's the same, the doctors are friendly, the staff's friendly. It's basically a therapeutic environment where you can calm down and learn to trust, learn to talk. You know, in the ward, you're not just in the ward, there's activities in the ward. There's crafts, there's talking groups, there's ping pong, there's music, there's TV. So it's a relaxed kind of atmosphere. And it's very stress-free, it's very low stress. So you can recover and you can see where you can go once you've recovered, you can move forward.
Some people go into the hospital, they're doing okay, but they need to change their medication.
Yeah.
So they'll go into the hospital for a period of time while they change their medication. Because these medications are quite complicated. When you change medication, you have to wean off of one, like slowly lower the dose of that one, and at the same time, you're increasing the dose of the new drug. So you kind of have to do it that way. Otherwise, you'll get much sicker. So some people do go into the hospital for a period of time while they're adjusting their medication too, because like you said, it's safe. You know.
When you first, so I gather from what you talked about that now you can self-identify that yes, I have schizophrenia and this is.
Yeah, well, exactly. I mean, that's the first step into healing, right?
Okay.
It's almost self-deprecating that, hey, if I don't address this, it's going to defeat me. And just by acknowledging that in a simple way allows you to say, hey, you know, like our Schizophrenia Society is on Broad Street, one of the busiest streets in the city. It's just getting corner from the hospital. And I think putting that place there is probably the best thing they could have done for us. Because, like, I mean, I walk in there and the town is small. It doesn't matter. Whoever sees me, I really don't care, you know? But I'm going into the Schizophrenia Society because I'm going to go see Jackie, right?
Okay.
You know, so that's what I'm saying, you know? So admitting, hey, I have this illness, you know, I have it, so why should I put it in the closet in the back store somewhere, right?
So when there's been times in your life when your medicine wasn't working the way it was supposed to be, and at that time you'd have an episode.
Yeah, psychotic breakdown.
So could you identify that something's wrong at that
Well,
point?
yeah, I mean, that's the thing, like, this kind of insight into the suffering comes much later, probably into your 30s.
Okay.
So, I mean, because basically you're looking at a period of wellness and a period of unwellness. So if you have a period of wellness for 1 year and you fall off for a month, you can look back and say, well, I was on this same medication, but I was going to school and I was working. Now I can't seem to get out of bed and I want to smoke pot and I want to stay up all night and watch the TV and not do anything. So I mean, in the period of wellness for that year where you've been productive, that's why it's important for a lengthy period of productivity and wellness. It serves the patient in a better way.
So before you were diagnosed,
Yeah.
how scary was it?
Oh, it was scary. Like, like I said, I did drugs of all kinds, right? I mean, I live in North Central, right?
Yeah.
And, you know, like, nobody knew what was going on. I didn't know, you know, and like, our relationship just ended. I was in drugs. I was working part-time. I was trying to go to school. I was trying to maintain relationships with my family. So it was very overwhelming. I mean, the drugs were not the cause. It was a trigger associated with the stress. So, I mean, it was a lot on me, like more, it was a breaking point for me, right? So, I mean, like, from about 81 fall to 83, 84 spring, it was very, you know, tumultuous, volatile, angry, you know, just everything happening. I mean, like, the thing is, with this illness, it strikes you down when you're very young, right? It's a great disabler of youth, is what they call it. And I mean, like, with the medications we have now, we can move forward, we can, I mean, the model of our psychiatry has changed over the last 30 years in 3 different ways, so.
Yeah, the older medications, they would make them almost, the patient would be almost like zombie-like.
Yeah.
We'd have all these really negative side effects, so
Yeah.
a lot of people were thinking that the medication was making them worse
Yeah.
than better, so they would go off of it. With the new medications that we've got now, they're cleaner. There's still quite a few side effects, like high incidence of diabetes, weight gain. You know, some people develop a tremor or a few little tics or things like that. But they are much cleaner and they are much more effective. So that's actually making a lot more people to be able to be in recovery nowadays, now that science has kind of gotten better. So that makes it.
Yeah, even into the 80s when I was diagnosed, it was still very taboo, you know, like, my mom didn't even want to say the word, you know, like, you know, my dad didn't know what it was, he just knew it was bad, and that's it, right? So.
That was my next question, is that
Yeah, it was very hard on my family, yeah.
We work with, at the Society, a lot with families now too. We've got a class that we teach, it's called Strengthening Families Together. And then we also teach a class for individuals with bipolar or schizophrenia or major depression. And it's all on that recovery we were talking about, kind of setting your goals, managing your medication, and, you know, living a productive life. And then we run support groups too. So we find that it's really important to help support the family as well, so that they can help support their loved one.
Is bipolar a chemical imbalance?
Yes, it is, yeah. It's more on the side of the serotonin. The neurotransmitter serotonin is too high, which ends up like fluctuating their moods. They ride this wave, they go, everything's okay. Even like my sister's story, the first phone call, everything's okay. And then she went into depression, and then she rode the wave back up to that anxiety where she was running 100 miles an hour. That's what we call rapid cycling. For somebody that's bipolar, usually it's like over weeks or over months. They'll go through that wave over a month. And the really scary part of it for bipolar is when they're in that manic stage. It's quite scary up there. You can have hallucinations and delusions up there too.
Well, also the dopamine and serotonin are responsible for a kind of a manic high. And when you smoke pot, it does the same thing as...
Yeah, it increases your dopamine.
Yeah, so when you smoke pot, it's not actual pot that's getting you high. It's the pot triggering the release of dopamine and serotonin. So I don't know if that's making sense. If you smoke pot, these things are released in your brain and you get high. If you don't smoke pot, you're under stress, and they are released in your brain at that level, it produces an artificial high as well.
That's
so,
where the stress trigger
it's the stress,
is involved.
Yeah, it's kind of a narrow area of,
And we're still learning more and more about it, so, yeah. Maybe I'll collect, do you guys have the evaluations done? Maybe you can collect those.
Sure.
Can we take it? I need to.
Thank you.
Can alcohol trigger it as well?
Yep.
Yeah.
Yep.
Anything intoxicating.
All street drugs and alcohol.
Yeah, yeah.
That's what you say that.
Bipolar can also be like bursts of like anger, right? Like being like happy one minute, then kind of sad the next.
Yeah.
Yeah, that's part of what my sister's working out with her therapist, because she's quite angry right now, which is the opposite of who she was before. She's very bubbly, social, laughing all the time, and now she's got this anger that she doesn't like. It bothers her quite a bit, but she has an anger. And some of that comes from frustration too, like having to deal or manage with this illness.
And then she also like knows, she's like, this isn't me, but she can't help but
Yeah.
feeling it.
Exactly.
yeah.
Yeah. It's not fundamentally who her
Does
personality
anyone else
is.
in your family have
No.
schizophrenia?
And actually, there is nobody else in my immediate family or siblings' kids or cousins. Yeah. I mean, like that's the thing, like that's where the source, I mean, like Dash was saying, is it genetic, is it environment, or both, or, you know.
That's why we don't know, like,
Yeah.
you know, you'll have somebody that has absolutely no history, family
Yeah.
history of it, so it's not all genetics. Well, thanks guys for listening to us today. We appreciate the opportunity to come out and talk to you guys. If you do have any future questions, feel free to contact the society. My name's Jackie. Just contact information's on the pamphlets there. You can ask me a question or send me an email.
Thank you. I think we all learned a lot.
Oh yeah.
Good. Keeps us motivated to keep doing what we're doing. And,
Yeah, it's really
head out
good.
before the bell and then I think what we'll do is we'll head out so we miss the traffic out in the
Sure.
hallway.
Okay. Are you leaving right now?
I was kind of thinking we might.
Okay,
That's okay.
that's fine.
Is there about 5 minutes left in the class?
We have probably 5 or so minutes, and that's fine. We'll.
Unless you guys have